Today, we're going to be talking about the challenging cost of care, followed by what I think is going to be a robust discussion between our moderator, Maria, and our partners about current challenges and the ways we can address them. And I will move into the presentation. So I'm going to be presenting on childcare costs from birth to age 12, the unaffordability crisis of childcare and out-of-school care. And through this presentation, I'll go through definitions, data sources used in this analysis. I'll talk a little bit about costs versus household incomes, childcare affordability, and our findings around that, and our findings around childcare cost burden, ending with key takeaways. Now, to get into definitions. So when it comes to childcare affordability, that refers to the share of families with children who pay less than 7% of their annual income on the estimated cost of childcare. So the threshold for childcare affordability is based on the U.S. Department of Health and Human Services Childcare and Development Fund benchmark that family copayments should not exceed 7% of a family's income. So that's what we're using in this analysis. When it comes to childcare cost burden, that refers to the cost of childcare for one child as a percentage of median household income for families with at least one child under 12 years of age in this particular analysis. As a note, I do want to note that preschool childcare cost estimates refer to any full day care child options that families need to use if their child doesn't receive publicly funded early care education, such as 3K, pre-K, or vouchers, and programs such as that. School-age childcare cost estimates refer to before school or after school care, as well as care during vacation time and summers. And so while after-school programs like Compass exist, which I'm sure we'll touch on later, these programs are not universal, and many in the city do not have access, especially children in elementary school. So they're included in our analysis as well. So getting into the data sources used in this analysis, there actually are two. The data on childcare costs comes from the 2022 Childcare Market Rate Survey from the New York State Office of Children and Families, which surveyed providers during 2021 and 2022. The data from the survey is used to actually reimburse providers as required by state law every 2 years. And estimates of median family income come from the Census Bureau's 2021 American Community Survey 5-year estimates. So this data set really provides us with demographic information like age of children, household type, like when it comes to single parents or married family households and incomes and so on. And those details actually help bring the data on care costs to light about what care looks like for different families. As I mentioned, data for childcare costs comes from the New York Childcare Market Rate Survey, and those estimates are broken down by age cohorts and by setting. These are specific to New York City and the city as a whole. So in this chart, you can see 3 age groups: infants and toddlers, and preschool age children, and that's 3 to 5, and school age children, age 6 through 12. And that's split between home-based care and center-based care. And we can see that center-based care is slightly more expensive than home-based care. For instance, looking at infants and toddlers depicted in the teal blue color, for center-based care, the estimated annual costs are $20,176 compared to home-based care. For babies and young children, it's $16,250. And for additional background on incomes, let's look at median income. And median income, of course, refers to being right in the middle of the income spectrum. And this chart is showing median annual income for families with young children under 5, broken down by household type. For all families in general, regardless of household type, the median income was $86,000 in 2021, broken down by the following categories: married couple or two-parent families, they had a higher median income of $108,150, and for single parent households, they had the lowest incomes with $46,700 in 2021. And you'll notice the comparison to 2018, or what things were like pre-pandemic, and we can see that median incomes for families have increased slightly. However, as we'll see very soon, childcare is really expensive, and it would take up a huge share of families' incomes. So while this rise is notable, when it comes to childcare costs, it's still very unaffordable. So jumping into childcare affordability. And keep in mind the definition of affordability that we're using is that costs can't be more than 7% of a family's income. Otherwise, it's considered unaffordable. And across the board in New York City, our analysis found that more than 80% of families cannot afford care for a young child under the age of 5. And speaking of how that plays out across the city, while we have this statistic that 80% of families can't afford childcare, there are differences and disparities across different neighborhoods. As an example, this chart is showing the share of families who can actually afford care by neighborhood. And it's looking at specifically infants and toddlers, age 0 to 2, and you can clearly see the disparity between the richest neighborhoods by income compared to the poorest neighborhoods by income. For instance, the median income in Greenwich Village, Lower Manhattan, the Tribeca, Battery Park area is $445,000. And 70% of these families can afford childcare, compared to Mott Haven at the bottom and University Heights in the Bronx. There are basically no families who can afford childcare. You see that 0% and 0.4% in Mott Haven. So as I mentioned before, affordability varies depending on the age of the child, the household type, and even the setting. So the purple dots here are showing affordability for infants and toddlers. The pink and fuchsia dots are showing affordability for preschool age children, and the bluish teal is showing out of school care costs for school age children. So among all families here on the left, we can see that 24% can afford out of school care, 19% can afford pre-K level care, and only 15% can afford care for babies. Center-based care in comparison has slightly lower rates of affordability for the three groups you'll see in comparison, and that shows that affordability rates are all less than 10%. For instance, only 3% of single parents can afford center-based care for babies, and only 5% can afford home-based care for babies. So those are very, very small numbers. And so there's a big difference between household types, largely because of the difference in household incomes. When it comes to single parent families, those are typically going to be single income. And I do want to note, in terms of out of school care, the cost estimates for school age children are based on the setting categories. So you'll notice home-based care, center-based care, it might not make sense. Those are provided by the survey. And so after school and youth programs in the city will not necessarily be identified by this sort of distinction or breakdown, but this is what we do use based on the estimates in the survey. So to put this all into perspective, the median income for families with children in 2022 was $77,681. But in order for a family to afford childcare for just one baby under 2 without any financial assistance or benefit, the family would need no less than $232,000 in income in order for that care to be considered affordable. based on that 7% or less definition. And speaking of income, I will now move into talking about another way to measure financial strain on families when it comes to childcare. Childcare cost burden, which is the percentage or share of household income that would go towards childcare costs based on market rates. Again, here is a breakdown by household type and age group. Reading from the bottom up, we'll see that married couple to parent families face an 18% cost burden for childcare for infants and toddlers, noted in the blue, 13% for pre-K, and 12% for out-of-school care, like after school and vacation time. Single parents have the highest cost burden, you can see right here, and that's the cost that would get taken up by childcare without any assistance. And that's between 26 and 41%, again, depending on the age of the child and the care they're getting. And across the city, when it comes to all households, that would be between 15 and 23% of income, family income, going towards childcare, depending on, again, the age of the child, whether they're a baby or preschool age or getting out of school care. Now, to put this into context, like to give you an example, this is using a two-parent family with 2 children as an example. And this visualization tracks costs across 6 years. So what would that look like for a family with 2 kids? So in year 1, we'll start at the beginning. In year 1, for 1 infant, it would be around $16,250. Same with year 2. The child is now a toddler. And in year 3, we have baby number 2, yay! And now that would be around $14,300 for the 3-year-old, the older child, for full daycare, and $16,250 for the infant. In year 4, the kids are growing up. In year 4, ideally, child number 1 is in pre-K, so out of school care is $10,840, and full daycare for the toddler. The next year, it would be 1 school-age child who's in kindergarten and a 3-year-old in full daycare. And lastly, in year 6, both would be in school, including the younger one in pre-K, and the family would have out-of-school costs for both of them. And that adds up to $136,960, assuming the family uses less expensive home-based care settings when it comes to care. So that's an at least number to give you some perspective. So here are some key takeaways. I know we talked through a lot of charts and graphs. Here are a few points I want you to remember in terms of the real cost of care. And you don't have to remember the exact numbers, but when it comes to cost burden, a family with 1 child under the age of 5 might spend between 14 and 41% of their income on childcare alone. Separately, a family with 1 child between ages 6 through 12 might spend between 11 and 26% of their income on out-of-school care. And when it comes to affordability, among all families with school-age children citywide, only 21% of families can afford center-based care for 1 child age 6 through 12. And lastly, what I started off with, more than 80% of families in the city cannot afford childcare for a child under 5. And I'll repeat that again. More than 80% of families in the city cannot afford childcare for a child under 5. And with that, thank you everyone for going through this analysis with me. You can contact me at my email if you have any questions. Laura, if we can put that in the chat, that would be great. Our database also has this data posted as well, and you will see a link in the chat as well to our full cost burden analysis report, which goes into more detail. So now I will turn it over to my colleague Maria to transition us to our panel discussion. Maria?
Thanks, Rimsha. And thanks everyone for joining us today. My name is Maria Drobnjak and I'm a senior associate here at the CCC. And I'll be discussing today with our panelists the pressing crisis that we are in today. And of course, affordability of care is top of mind for many parents with young children and school-age children. And really, this sector deserves a robust investments and not cuts. So we are like this webinar today is really call to action and really for us to grasp this data that we just heard about from my colleague and also kind of hear more about the larger context that we are in today. So, however, the most recent modifications to the fiscal year 24 city budget, which is the one that we are currently in, proposes a devastating future for New York City's children and families. The November budget modification includes over 7.5 billion in cuts to city tax levy funding, including 1.7 billion in reductions to the current fiscal year that we are in now, and 1.9 billion in outer years, which means in years fiscal year 25, 26, 27. And while these cuts touch every aspect of families' lives in New York City, we are very concerned about the budget cuts to early care education, to after-school and summer programming. And these cuts could actually result in loss of anywhere between 6,000 and 10,000 early care education seats, and also over 3,500 slots in Compass after school. And concerningly, the action taken in the proposed November budget modification is only a third of a 15% reduction anticipated as the mayor's releases the preliminary and executive budgets for fiscal year 25. You will see in the chat a link to our analysis of the November cuts, which goes into more detail as well. And now I would like to transition and really welcome and introduce our three panelists who have been advocating alongside CCC and many others to oppose budget cuts, expand services, and invest in the workforce. So I'll start with Shanita Boland. She's the Chief Operating Officer at EC on the Move. EC on the Move is a group of more than 600 early childhood educators who provide home-based or family childcare in New York City. Shanita engages in grassroots organizing and advocacy around campaigns that directly impact the early childhood sector and really develop tools and strategies to help providers navigate the federal, state, and local regulations. Shanita joins us today to help raise the profile of early childhood education in home-based settings specifically, and speaks about the work that she does to create a powerful early childhood education sector that supports a modern workforce. I will also introduce Gregory Brender. He's a Chief Policy and Innovation Officer at Daycare Council of New York. It is a membership organization of over 100 agencies that operate more than 250 publicly and privately funded childcare centers and family childcare programs in New York City. In his role, Gregory advocates for childcare-friendly public policy by engaging policymakers, advocates through publications, public testimonies, advisory committees, and coalitions. Gregory has been New York City child advocate for many years, working on policies and practice in the childcare and after-school spaces. So happy to have both of you today. And the third, I will introduce Nora Moran. She's a director of policy and advocacy at United Neighborhood Houses, which is a policy and social change organization representing 46 neighborhood settlement houses that serve 765 New Yorkers from all walks of life. In her role, the goal is to ensure that children, families, young adults, immigrants, and older people really feel that city and states represent them and they can play a role in shaping the growth. And she joins us today to speak to policy and budget concerns about childcare for school-age children, including after-school and summer programs. Thank you all for being here today with us. And I can get us started with my first question. Like, we all know that access to childcare is essential for families to be able to work and support their families. But we also know the childcare system is very complex. So I would like us, if you could describe to us the structure of the systems we are talking about. We heard that we have childcare for infants, toddlers, preschool, school-age children. What does the system look like today? And if you can describe some historical milestones that have gotten us here. And maybe we can start with Gregory, who can talk about the landscape here in the city.
Thank you, Maria. Really exciting to be here. New York City has a complex childcare system, and its complexity is a necessity to reflect what a diverse city we are. and diverse in so many different ways in the types of needs that parents have, the types of care that families are most comfortable with. And so in the early education system, we really have a mix and a hybrid where you have home-based providers, you have center-based providers, and you have some programs for pre-K in the public schools. Um, and the different types of services they offer really reflect both the different parent needs and also the capacity to provide care where we simply don't have enough child care for families throughout the city. Um, New York City really has been at the forefront for many decades in creating innovative models of early childhood education. The model of contracted childcare that we have now, that is our Department of Education contracted system, comes from when Fiorello LaGuardia was the mayor of New York City, and soldiers were leaving to fight in the Second World War. And these centers were initially created to provide support for mothers who are now working. And the Daycare Council was actually founded at that time to advocate for the continuation of childcare centers because we recognized that the city had changed and that there was a continuing and permanent need for full-time care for young children. And so this system has been a model for systems nationwide, including Head Start. And it's really crucial that we have comprehensive care that includes um, strong curriculum, but also includes a full day of care. Home-based percent programs are also, and I know Shanita will talk more about this, also crucial to the system as we see more and more families needing home-based programs, particularly for infants and toddlers, but also because the unusual hours they can offer, because of the flexibility they can offer, and in many cases the cultural and linguistic competence that you see in home-based programs. So it can be a bit daunting to understand why are there centers here and home-based programs and programs in public schools? But it really is crucial that every family has the childcare options that they need. And we know that children succeed when they're in quality childcare programs.
Definitely. Thank you so much for sharing that. And we also know that the childcare system in the city is affected both by the city and state policies. So, Shanita, would you like to share more about how these two are affecting the childcare in the city? I think you're on mute. Yeah, that's great.
Well, thank you. It's definitely great to be here. Thank you to CCC New York for having us and having this very important conversation. For sure, I am a previous family child care provider for 16 years. And so a lot of my lens and working for ECE on the Move, we are serving family child care throughout New York City. And so my conversation will mostly be through the family child care lens, which is care for through residential settings. So we are a professional modality of care. We care about our work. And yes, to talk about how policies affect this modality and the other modalities, child care center based as well. We are regulated by the state, and family child care, it has a relationship with licensors, and we go through stringent ways of getting our licenses. We have to understand regulations and health and safety practices. We are in the neighborhoods where we're right in the neighborhoods where families are. There are more family child care providers in the neighborhoods than there are centers in each neighborhood. And so it's much easier for a family who want to take their child to a for care in the building that they live in, on the same floor that they live in, across the street. We are here. We are responsive, cultural responsively. So it may be if family child care providers in your neighborhood. We may be we may address the same cultural needs and norms that you have in your home, the same foods. Also, families may have specific needs that a family child care provider could address, health-wise. The way we care for the children, there's more opportunities for one-on-one care. So we responsive care for one-on-one most times, because of our groups are so small, much smaller than in center-based. All of the modalities, wonderful, but this is about parental choice and where they choose to bring their child for care. As far as how we are affected by budget. So this is the basis of this conversation today, is affordability of childcare, and our methodology of care is greatly affected by the budget. When childcare provider is underfunded, it makes the care underfunded. When we are underfunded, it affects the quality of our care, the quality that the parent wants. We can only offer what we are afforded, what the types of resources that we can afford. And I know as we get into the conversation, we'll get more into what that looks like, but definitely the budget affects what goes into the state budget affects how providers offer care in their homes or in center-based.
Thank you so much. Everything you said is so important to kind of keep in mind and understand. And maybe I can transition to Nora, if you can tell us more about the publicly funded summer and after school, just like thinking about school-age children and really how we should be thinking about that age group, because it's really critical to support parents and youth development.
Yeah, so I think it's important to remember, when we talk about childcare, it doesn't just end when a child gets to kindergarten. We have to think about it, that 3 to 6 p.m. gap for a lot of working parents, and then summer coverage as well. So in New York City, I think building off of, Gregory's comments, a lot of, what we think about and when we look at our after-school landscape, New York City is a real leader, nationwide. We've invested a lot of our own tax dollars into a positive youth development system that offers after-school workforce training, all sorts of supports for older youth. And so when we think about after-school specifically in the publicly funded after-school system, there's, I would say, probably about at least 180,000 youth served in the wide array of after-school programs in New York City. So that includes things like Compass and Sonic, which is after school for elementary and middle school students, Beacons, which are, sort of like community center type programs in public schools, and Cornerstones, which are, community programs in New York City Housing Authority developments. And so that network together serves, over 180,000 youth and provides really important support for both for children, right? It's really good for school-age youth to have a space that's not school, not home, to explore, to find out what they're interested in, to make friends, to, be in a setting where they can learn about themselves, learn about the world, discover their interests, whether it's art, music, dance, all those kind of enriching things that we know, make a well-rounded person. And so that's kind of the system that, covers the school year. During the summer months, most recently, folks will know summer programming under the name of Summer Rising. It's been the, program that's existed the past few years where, Department of Youth and Community Development providers, community-based organizations work alongside Department of Education, teachers, and staff to provide summer programming to kids. That is an incredibly popular program. This past summer, there were 110,000 kids served, but almost 140,000 applied, right? So there's a huge demand for summer care, especially. We know that that's an expense as well for families, something that a lot of parents, scramble with, especially, securing that care early. So you don't have to worry in May and June, what am I going to do in July and August? So that's just a little bit of, the landscape in New York City.
Thanks, Nora. And I'll just say, like, as we go through other questions, like, keep in mind these numbers, like 180,000 of youth. We also know that there is around 120,000 children under 5 being served in publicly funded system. So all of these families are going to be affected. So as this sector, I can transition into the next question, as this sector, which is very complex, faces significant challenges in sustaining funding, providers are facing a federal fiscal cliff as COVID funding dries up. Providers also are still feeling the effect from payment delays by the Department of Education. And now providers are facing these looming city cuts laid out in the November's modification that I talked about earlier. What will be the impact of the loss of these programs for families, children, and providers? Because these cuts of funding will mean fewer seats. Nora, if you would like to start.
Sure. So, very specifically, it's going to mean 3,500 youth who don't have access to after-school programming. We saw in November, the mayor's November budget modification detailed a budget cut, citing they were, sweeping back 3,500 after-school seats. And that is, really devastating when we think about how this webinar started. All of the stats that we've presented about unaffordability, just how challenging it is for families to live here. News that came out earlier this week that the people leaving New York City at the fastest rate are people making between, I think it was about $35,000 and $65,000 a year. That's a crisis. And so even though maybe 3,500 seats sounds small, it's not a lot of kids, think about the ripple effects that has. That's 3,500 parents that are able to keep working, generating support for our economy, things like that. So, that's something that's very concerning to providers, on top of, a lot of the, COVID money that we know is going to run out in the Department of Education, other things like community schools, other supports are at risk for older youth. And so that's something that, is certainly very worrisome for us.
Definitely. Thank you so much for sharing. Shanita, do you want to share anything about?
Well, in the family childcare sector, cuts is not something we want to see. We don't need cuts. We need extra money in the sector, in the whole childcare sector. Right now, we're seeing lots of empty seats in the programs. We see providers contemplating getting jobs, not fulfilling their passion for working with children in their homes, in the family childcare sector. We see providers contemplating, not wanting to, but having to downsize if they cannot afford to pay their assistants. Of course, no one wants to do that. And of course, they will maintain their licensing in hopes to fulfill the seats in their classroom. So on the ground, because we are talking with providers on a daily basis, what's happening? Providers are showing us pictures. They're telling us stories about the empty seats. They're showing us pictures. There are assistants with just a few children in doing activities in the classroom. They're also telling us that they're grateful for the stabilization grants that they got, but this sector needs to be stabilized, period. We need a permanent solution to paying the workforce and retaining their programs and happily moving forward, offering care the way they always imagined that they would.
Yes, and I would have a few things to add, like as we pivot to the new questions, other questions. But Gregory, do you want to share anything on this point, or?
Sure. We know what happens when families lose access to childcare, and that's what's being proposed in the mayor's budget cuts. So the reverberations, it impacts children's educational outcomes. We know that children who have access to high quality early childhood education start kindergarten better prepared to learn, and they usually have better outcomes. And we've seen time and time again huge returns on investment from investing in early childhood education in both increased outcomes and decreased use, decreased need for special education and even incarceration in the future. And so cutting early childhood education, making it unavailable to the families who need it the most, will increase those costs in the short term and in the long term. We also know that it affects the economy immediately because childcare is a core support for working families. It's a core reason, as Nora mentioned, that families are staying in the city. You will often hear parents saying they can stay in New York City because we now have universal pre-kindergarten and because we have affordable childcare programs, and they can keep their jobs. So you're going to see people leaving the workforce and potentially leaving the city. You know, everyone in the city, from the mayor on down, has been talking about filling back up our skyscrapers with office workers and everyone else, and we can't fill those skyscrapers up if we don't have the children of the people who work there in quality childcare programs. Since you also mentioned it, I just also want to talk about what's happening with late payments, because this has been a real betrayal of some hardworking New Yorkers. The early childhood education sector is already underpaid, and because of late payments, providers have missed payroll, and people who are, in some cases, living paycheck to paycheck are waiting weeks to get their payments, and it is not right that in this city that is happening. So it is something that we know can be addressed, and we hope that the city can address immediately.
Definitely. And I think Shanita, like bringing up the open seats and you're talking about payments really takes us to the next question and really the workforce, like focus on that. Before I jump into the question, I just want to say that we have been elevating several challenges that providers face through the work that CCC has done in the past year, and a report that we published in May that you can see in the chat. And I want us, like, when we go through these next two questions, thinking about providers and parents' challenges, to think about open seats really as being the result of multiple challenges that are being faced on both sides, because they have been also used to adjust, to like really like to explain why the cuts are being made. So I just want to name a few challenges that providers are facing, and Gregory already started with the delayed payments. We also know that over time, in the last couple of years, we have been seeing increased share of school day, school year seats. And we also know that that option really is affecting both parents, but also providers. And also, along with the centralized enrollment process within the DOE, these two are really creating fiscal instability for providers. We also know that contracts are not flexible. They are inflexible, and providers cannot really address emerging community needs, thinking, do we need to serve 3-year-olds or 4-year-olds, hours of care? And we also know that providers don't have financial resources needed to do the outreach. So like, as I'm thinking, do parents know about options available to them? Do parents know about contracted seats that are budgeted for? And I know that we heard many discussions on this topic in the past year. And also fiscal and operational instability, as Gregory said, for providers is affected by payment delays from the city, and also pay for enrollment model, which impacts how providers are being reimbursed. And having and retaining qualified staff has been an ongoing issue among contracted center-based providers, even after achieving initial steps towards salary parity in 2019. And it's really important to keep that in mind. Like, we had a victory, but we have workforce issue that has been with us for many years. And these combined challenges in the field have led to workforce shortages across the sector. So maybe we can dive a bit into kind of this workforce aspect. Shanita, if you would like to get us started on this one.
Yep, definitely. Well, we're hoping that with new budget, especially in the city budget, that contracted care will look a little different. The enrollment system needs a whole overhaul. You're talking about, for family childcare providers, we're talking about women who are used to opening their door and being there for the community and showing their space. And it's as easy as opening the door, showing their space, talking about the needs that a family needs, and then enrolling. It's really step 1, 2, and 3, we're in. You know, it's not like that anymore. There are too many loopholes. There's too many waiting lists to go through. I get it. I imagine the city is doing their best to move things along. It's not enough. It takes away from the ease at which families approach care with their provider. And it's as simple as, I love your service. I want to use you. How do I sign up? It really needs to be that easy. And then it needs to be as easy as, oh, I have space, and this is the cost. And what we want is a system that fully funds childcare. We don't want to rely, families, as you outlined earlier, cannot afford what it truly costs to offer childcare. There's no way. We do need assistance from the state, the city, from everywhere to make this happen. If childcare is truly a part of the infrastructure, we have
Yes,
to care
yes.
about it. We have to care about it. But so much is needed to overhaul the system that it's easy for to make it easier for parents to access care and providers to have care and have a bottom line that they can work with and pay and be happy to offer services. A better enrollment system is definitely, again, on the ground. We have a system where we are hearing grievances from families and from providers, and everyone is saying the same thing. The waiting lists are way too long, months and months. Families are forced to choose, go for options that weren't their first choice because of the loopholes and the waiting lists to get to their first choice, which was probably their neighbor, you know, that they trust and has been doing childcare for years. So this is what we're facing on the ground. We're taking these grievances as fast as we can to outline and illustrate the problems that exist today in obtaining childcare.
Definitely. Do you mind telling us more? We know that last spring, the Governor Hochul announced the workforce retention grant of 500 million investment to support 150 childcare workers statewide, paying for things like bonuses, payments, and getting a new staff. What has been experienced with among providers with accessing this resource?
And so we are now understanding that childcare is a priority to the governor. We want to see more of that, but coming off of pandemic and stabilization grants, that period, those were incredibly helpful to keep the sector alive coming off of a pandemic and making sure the providers didn't leave the sector altogether in specific. I'm sure for the whole sector, but in specific, for our providers on the ground, the stabilization grants help keep the doors open and available for those who needed it going back to work, even during the pandemic and after the pandemic. But we begin to see that we have to fight for what was just a Band-Aid. We need permanent solution to stabilize the sector. It is not about stabilizing a sector for a pandemic. It's about stabilizing part of the American infrastructure, making childcare important at all times, not just during a pandemic. We were here before the pandemic, during and after. We need to be considered important, a part of the American infrastructure, and support to families and educators. This is what we need. And the way we do that is to fully fund childcare, make sure that the workforce is thriving and happily offering childcare, doing their dream, educating young ones, and families are happy and children are running into those doors. Those are the dreams we have, and they are not being fulfilled because our monies are going down. Stabilization grants are over, and therefore, where do we go? What do we turn to? Do educators start to take on second jobs now just to stay alive? And their dream doesn't become their dream of educating young children is no longer a primary dream. They've got to facilitate their lives by doing other jobs that they would not have wanted. No, we want to fulfill our dreams of being the best educator we can be, serving the families in our neighborhoods, but we need to thrive to do that.
Absolutely. And also thinking about the city and like one of our, like for Gregory, one of the biggest workforce challenges for us was also in the city about the pay parity. Could you explain what that means for the sector and what really needs to happen to achieve that sector-wide parity? Like thinking about the workforce.
Absolutely. The pay disparities between the staff, teachers, and directors in community-based organizations and their counterparts in public schools are really dire, and it is leading to a workforce crisis in childcare centers. We conducted a survey over the summer of childcare centers and found that most new teachers were leaving within 5 years, and then a significant number of teachers also had more than 20 years of service, meaning they're likely coming towards retirement age. So we are really seeing a loss of staff, teachers, and directors in the system because they are underpaid. It is understandable why they're leaving, but we need people who are committed to early childhood, who've developed the experience, the expertise, who know how to run a classroom of 3 and 4 year olds and younger children too, because that is a tough skill to develop. Um, what we've seen in so as you mentioned, in 2019 we did achieve a victory where a collective bargaining agreement was funded that brought us to a path to parity. It took some important steps. Most importantly, it brought the salaries of certified teachers in community-based organizations up to the starting salaries of certified teachers in the public schools. However, it left out many pieces, and it's also expired. So we need to have a new collective bargaining agreement that goes where we didn't get to in 2019, and that includes longevity for the staff, because the biggest differentials really happen when you have veteran teachers and veteran staff members and veteran directors, and addressing the need for salary parity for all of those folks who are not included, which include uh, support staff and directors, many of whom are also struggling to stay in their roles. Some of the things we found that over a 25-year career, an assistant teacher will lose $235,000 in earnings by working in a community-based organization instead of a paraprofessional role in a public school. Similarly, a certified teacher will lose $1.7 million in earnings over a 25-year career. And a director will lose $2.2 million in earnings by working in a community-based organization instead of being a director within the New York City public schools. These disparities are affecting our workforce that is primarily Black and Brown women, and that is serving many of those high needs neighborhoods in the city. It is something that we know the city can address, and it's time that we do.
Thank you, Gregory. I think with Shanita and Gregory, like covering both ends of both sides of the sector, it's really important to keep it in mind. And Nora, do you mind? Could you describe the challenges and opportunities unique to the after school and summer workforce?
Sure. So, a lot of the workforce challenges that we've seen across the board, right, not just in after school, those are impacting the youth development space, the after school, the summer space. The past few years, it got a little bit better this past summer, but really kind of since things opened back up after COVID, the past few summers and during the school year, there's just been a very hard time. After school programs have had a hard time hiring staff, retaining staff. A lot of that is due, we think, to the low wages in after school programs, right? Oftentimes, the way that these programs are set up, the contracts from the city are only for a specific amount of money, and they don't go far enough to cover competitive wages for staff. So a lot of the times in an after school program or summer camp program, you're making minimum wage, maybe $15, maybe $16 an hour. And this is hard work, right? You're caring for kids, particularly in the summer. It's hot. There's a lot going on. This is not a walk in the park. And we heard a lot from providers that they were competing with other places like Starbucks, like McDonald's, like Target, that could hire people at, more than minimum wage, right? Maybe $18, $19 an hour, and even in some cases, and it's work that was easier, right? You're in air conditioning, it's not so hard. The hours maybe are a little bit more flexible. And so, after school and summer programs are really competing significantly to try and hire and retain a workforce. And so, some of those stabilization grants that were mentioned were also able to go to after school staff. That was a positive step, right? But that money ran out because it was, federal COVID money that's no longer in existence. So that certainly is going to be a challenge going forward. We know that the minimum wage is set to go up in New York soon. So, we definitely need our lawmakers to have a plan for how are we going to make sure that there's funding available to pay minimum wage to staff working in after school programs. So some of the, specific things that we've been advocating for, we know that New York City is getting ready to basically do a reshape, a rebid of its after school system. Something that we've been underscoring is that, the funding in that program needs to support good wages. And because after school, like childcare, there are mandates around how many staff have to be in a classroom working with kids, which is good, right? We want to make sure there's enough staff in a space providing care for kids, that, there's that good staff to child ratio. You need to make sure that there's adequate funding there to pay staff livable wages, and also wages that make them want to enter and stay in this field, right? We see a lot of the times, people who start working in an after-school program or a summer camp go on to become teachers. They go on to, lead programs at nonprofit organizations. That's really good, right? We need to make sure we have that pipeline there, that people kind of see this as a career pathway. And so making sure that that entry-level job is a well-paying, positive experience is really important.
Thank you, Nora. And I'm just thinking about funding and how workforce is paid or not being paid adequately. Really is the budgets are describing our values as a society, as the city. So keeping that in mind, and they're affecting really, I would say, the bodies of young children. They're affecting our workforce, young workforce. So humanizing this and really understanding that these are our values in these budgets, it is really the key. And thinking also, just going to pivot into the next question, in a recent citywide surveys of parents and caregivers that we have done with all of your support in partnership, we learned about a lot of challenges and issues that families face in accessing services, which also can be that other side of the coin when we talked about open seats and why they're not being used. We learned from them that oftentimes they don't know where to go for information. They also are not aware of subsidies oftentimes, or they find the application process very intimidating. Many parents do need extended day year-round programs, but also care during the evenings, weekends, nights, which is currently not offered. And also many parents would trust leaving their child in organized care between the ages 1 and 3. And we don't really have many seats for that space, and family providers being the one filling that gap the most. And parents also said that they need more supports with mental health for themselves and their children. So thinking about these barriers to access for parents, what are your experiences from your own perspectives on this? Whoever would like to start first.
Yeah, I can start. So at Easy on the Move, we recognize that parents' first point of contact in this situation where they have issues, whatever the issues are, maintaining care even, or, helping family members to know where to go get care. There's always that question to us as a provider. Well, we're looking for, I know someone who needs to apply, doesn't know how, or reapplying is a problem. And so a provider, and at Easy on the Move, we encourage parents and providers to have strong bonds together, because we're in this together. We're flip sides of the coin. We're experiencing the same issues. in different ways. And so, yes, we can definitely agree that parents don't have readily access to the information. And so we developed, we developed the grievance system in which providers can assist parents in talking about their issue. And then we have brought the issues one by one, PDFs, to officials that we identify who may be able to help. But this is not a one by one off. Can you help this parent? We need to change the whole system and make it workable, get to the root of the cause so that we're not documenting grievances anymore and looking for people to help parents solve their problems. Why are they why is the waiting list so long? Who's going to contact me? I've gotten one generic email and no phone call. I have no idea when I'm going to be able to get my subsidy. I have to pay until it happens. These are all grievances we're hearing on a daily basis, and parents don't know where to go. And so that's why we've stepped into the space, starting with a provider that cares for the children, and they bring it to us, and then we do our best to see if there are answers out there. But the system must change, transformative change, in order to put parents at ease in how to get information and just basic customer service in the system. Just, a parent should feel at ease and happy and know that care is coming. There's someone to answer questions happily. Those things are not happening right now. Also, definitely, touching back on what parent needs, the supports that providers need to offer extended day and weekend care. There are no incentives. The incentives are few and far. There's a percentage tied to how much you can have over the market rate, and child care providers might choose extended hours but not be able to get pay for special needs. None of that should be happening. If a provider wants to help families with overnight care or weekend care, extended hours, and special needs, there's so many different types of care that is needed right now, and we shouldn't be worrying about if we've extended our possible percentages of over the market rate and all of that. That's just too much information. We want to get paid for the care we are serving, for the care we offer, excuse me. And finally, I just want to address the mental health supports. So what we're seeing is absolutely providers need mental health supports for working 10-hour or more days. Of course, they love their work, but this type of work, of course, you need mental support. But we're also seeing that, especially those in the contracted care, working with the networks who are affiliated with the Department of Education, there was some funding available, and providers had access to one-on-one support for the children who needed the extra guidance, and maybe those providers were not getting the special needs rate, but they had that one-on-one care. So we understand those funds are running out. We should not have to worry about funds running out when children need one-on-one. When children need that extra hand, that extra support, when providers need that extra support, we should not have to worry about there are no funds to support mental health. That is all.
Yes, I'll say parents definitely see providers as the face of the system without understanding all the nuances. And I'll say that intersection of really providing developmental behavioral health supports at early care education settings that their children spend so many hours, like aside from their homes, like it's crucial to think about. We should not be thinking about funding. Gregory and Nora, would you like to add something about
Yeah, so first I'll just give a plug for parents who are looking for childcare. Daycare Council of New York is part of the New York City Child Care Resource and Referral Consortium. You can find us on the web at nyccrr.org. And there are counselors available because we know the system is complex and we want to help families find the care that they need. There are also a lot of things, a lot of policy changes we can make to make it easier for parents to access care. A few notable ones that I think are really timely is there is legislation sitting on Governor Hochul's desk to decouple, to remove a requirement that couples the hours of care where the hours of care a child is receiving from the specific hours where a parent's working. This is just something that is logical that we know the child care day may not exactly align with work days, especially as work days are becoming more unpredictable with more people working in the gig economy, more people having more unusual. Not everyone's working 9 to 5. And so this legislation is awaiting the governor's signature. I imagine it'll come up later in the webinar, but Empire State Campaign for Childcare is going to be hosting a rally calling for the governor's signature on this next Wednesday at our office in Manhattan. Um, there are also a series of recommendations that was support that came out from the Black Latino Asian Caucus of the City Council, as well as Speaker Adrian Adams, that called for changes to make it easier for parents to access childcare, including having a hybrid enrollment system where parents can enroll right at their community-based organization instead of going through the centralized enrollment system, and reinstituting the specialized outreach teams that Department of Education had when they were launching pre-K for all. I think everyone who was in this city in 2014 remembers you couldn't go a block without hearing about the importance of pre-K. And now parents are struggling to find out how do they access pre-K. And that's because we don't have the same kind of multilingual, multicultural outreach that we've had in the past.
Definitely. Yes. Nora?
Yeah, I mean, I would echo a lot of what, folks shared. Thinking about older youth, there's often comments and questions of just, parents not always understanding, what resources are out there, not always being aware. Another big challenge that we see, I'd say this past year, the sign up and enrollment process for Summer Rising certainly did improve, right? It was not, the application was open for a set period of time, it's pretty publicized. But, some of those decisions were made kind of late. And so, it's, the earlier, particularly when we're thinking about summer care, the earlier all these processes can start, the better, because parents then have peace of mind. They know, and they don't have to scramble at the last minute, particularly if there are limited slots for, for example, for Summer Rising. If there's only a certain number of slots available, not everybody's going to get it. If you don't get it, you need to know so you can make other plans and work out other arrangements. So, I think that, echo what other folks said, the questions of like, how do I find it? All that stuff definitely plays out on the older youth side. And I think, the city's gotten a little bit better with its summer programming. But there's, always ways to start that even earlier and make that a little bit easier for parents.
Thanks, Nora. I feel like we touched on many aspects and many challenges throughout the webinar, and the magnitude of these is huge. And I'm just thinking, as advocates, it's really our job, and I know we all feel the same, not only to identify and call out the problems, but also to put forward the solutions that our state and city leaders can have, like a map for path forward, both for centers, for families, children, communities, youth. So maybe it is final question for today. Could you maybe outline some of the solutions and steps moving forward, and also how people who are joining us today and who will be watching the webinar in the coming days and weeks can take action? So maybe we start with Gregory, since the Daycare Council is a critical member of the Campaign for Children, which advocates for childcare across the continuum. Could you speak some of the most pressing EC policy priorities for this year?
Absolutely, and it's always great to collaborate with all of you in Campaign for Children and in the Empire State Campaign for Childcare. Just as like a tiny aside background on Campaign for Children, we were founded when cuts were proposed to both childcare and after school that totaled about $80 million. We're now looking at cuts of over $120 million in just pre-K and 3K. So Campaign for Children, Empire State Campaign for Childcare, all of us together are going to need to be an incredible grassroots force. So everyone on this call, I can see there's a good number of people on Zoom. We all need to get 10 more people involved and be at City Hall in Albany, writing letters, calling our legislators, doing rallies, being creative in how we do rallies, to really fight for the investments we know New Yorkers need. Some of our key policy priorities in early childhood education will not surprise you as we talked about them, but we need to act on salary parity. There is a workforce crisis now, and we need to invest in the workforce and ensure that they get the salaries that they need and deserve, so that we keep people in this system providing high quality early childhood education. We have to preserve the investments in pre-K and 3K, and when possible, extend some of the pre-K and 3K programs to be extended day, extended year, so that they have services in the summer, so that they have longer days that we know that many families need. We also need to restore the Promise NYC vouchers. These are vouchers that do not discriminate on the basis of a child's immigration status. And it is something that's truly crucial, particularly as we know there are many migrant families in New York City who need childcare, and are going to need high quality education for their children, for some of the newest New Yorkers. So we have a big fight ahead of us. It's going to take everyone from elected leaders to everyone in the community, parents, providers. Every New Yorker should be coming together and ensuring that we have the energy and have the grassroots power to make sure that we make the investments that need to be made.
Thank you, Gregory. This is definitely a call to action. Shanita, I'm thinking since EC on the Move is an active member in the Empire State Childcare Campaign that was brought up a couple of times. Can you speak to some of the most important state priorities in the early care education space?
Yes, we are critical, just like Daycare Council. Yes, EC on the Move is grassroots organization, which means on a daily basis, we are in touch with all of the family childcare providers who will have us on a daily basis, and to check in with them and see how they're doing and how the policies are affecting them and what are their needs, what are the needs of the families that they're serving. When you open that door and a parent says, oh goodness, I'm having an issue, get that issue so that we could document and see who we can present it to and get these issues done. And so the first thing we need in call to action is to recognize that we are in a child care crisis. Is everybody just gets that in their minds. If you have a daughter, more children are on the, we beget more children. We don't stop having children. We will always need childcare. We have to solve this crisis. Children are coming left and right. We have to have a system that works for everyone. We have to address the crisis. It's like if you're not touched by the crisis, you don't know that it's there. I have friends, myself, everyone, my friends, that their children are grown. Your children are going to have children. Their children are going to have children. We don't ignore the child care crisis. And so the first step would be to acknowledge that the crisis exists, and what we are doing to help providers and families is to set up those appointments and get familiar with their legislators. The legislators are in their neighborhoods. My mother has been doing childcare for many years now. After me, she thought it was lucrative. It's not, but she loves it. We're doing this because we love it. But now she can walk in the neighborhood and she knows where her assembly person is. She knows her habit that she waters her plants in the window. This is how comfortable we have to be with our legislators. We know how to walk there and turn in the children's work. See, thank you for supporting us. And here's something that my Johnny colored today. And they like that. The legislators want to know what's happening. But if we're not telling them and curating that relationship with them, then they don't know. A couple of years ago, I'm just going to give this because I just can't forget this. A couple of years, I'm going to say it was 20, we're in 23, 21. The assembly stood up in a conference for childcare because that was the first time that they really heard it, from grassroots, especially, that the investment was needed. But when the investment happened and the market rate went up slightly, it is now believed that there's no more investment to be needed. It was done already. You guys should be good. That's it. It's over. That is not the case. So we have to continue talking to our legislators and thank you for your support previously. We need more. We need a permanent work fund to support the workforce. Please keep going. Our livelihood depends on your support. So we have to keep doing that. We have to, if we're bringing our children to childcare, we have to let the providers know we're here to support you. Parents and providers united. That's what has to happen. Okay.
Thank you so much. And maybe just turning it back to the campaign for children from the youth perspective, Nora, what are some of the priorities in this space?
Yeah, I'd say our priorities are pretty simple. First, the cuts to after-school programming and the reductions in hours for summer rising care for middle school students. That was something we didn't really talk about much, but making sure that both of those cuts are rejected, right? We're preserving access, we're preserving the number of hours that we're offering. Those are two of our key priorities. And then making sure that, those base wages for staff are boosted, that they're, competitive, that they're, recognizing the quality of work that staff are doing, and that they are, good, so that way providers can staff up appropriately and serve, students at the full amount of capacity that they have. So I would say, those are our two biggest priorities. And then, some of the things that we can take action on, I know folks, Gregory and Shanita covered this really well, but one, I think, specific tangible thing that folks can do in the audience is, if you have people in your life who are looking for childcare or looking for after-school programming, let them know that these programs are available. Have them call a CCR&R if they're struggling to access them. Call 311 if you're looking for, a care for a school-age child. There are programs out there. Something we hear a lot, and we've talked about, is that families don't know, they don't really know how to access. We want to make sure that's never the case. And so everyone here now has that sense, right? Knows a little bit more. And we just want to encourage folks, to share that knowledge with people in your lives so that they know what's available and they can take advantage of the programming that's offered.
Thank you all so much. I feel like we got several ideas for how to act on this issue while keeping in mind it's a crisis across the continuum. I will turn it over. I want to thank you for joining us today, and I want to have some space for us to share more about Take Action that we created. So I'll turn it over to my colleague Rimsha Khan, and I would like to thank you again for being with us here today and for elevating this issue. Very grateful.
Thank you.
Hello again, everyone. We know we laid out some pretty stark information during this webinar, and we want you to know that there is something you can do to join CCC, ECE on the Move, UNH, Daycare Council, and many other advocates, parents, and youth who are calling on our elected leaders to stop the cuts to this sector and right the ship by investing abundantly in these vital systems. We have a live Take Action, an email campaign you can join by sending a letter to your elected officials. You will find that link in the chat, and we encourage you to take 2 minutes to fill out the form, to send a pre-written letter to your representatives, urging them to invest in childcare and youth services. So that link should be in the chat now. Thank you so much, everyone, for joining us today. You can sign up to become a member of our eAction network, where you will receive updates on our policy and budget priorities, actions, and analyses. Thank you. Bye.